The reason wine is beautifying to the inside of the body is because of its potent antioxidants, including glutathione. Therapeuticus is easier for us to understand because that's what we like to do. The definition is to attend, to worship, to treat medically. Notice that how smart the Greeks were. They already put in there to worship, and you and I know how long we often pray for one of our patients to get better. And if they don't get better, we worship that they go to our competitor or to the Mayo Clinic. Next slide, please. The importance of antioxidants was first taught to us by our mothers, Professor Mom. Remember that she would cut an apple, and it would brown if exposed to air. Here's the first example of oxidation. But if she would put some lemon, which later on we learned was high in vitamin C content, and more recently from the studies of Dr. Dean Jones at Emory University, the presence of glutathione in all these citrus products, that the apple would remain beautiful, the cosmetic part of the apple, and it would be therapeutic because it would not oxidize. Next slide, please. Well, what we want to do is maintain the balance of power. We know that the body has a built-in system of antioxidants, which we'll review shortly. You all know that. And they are the prime defenders. In the skin, obviously, the defense against exposure to ultraviolet radiation and other environmental pollutants. But to the rest of the body, the exposure to other free radicals. Free radicals that emanate from the process of metabolism by cells, free radicals that are generated by ingestion of alcohol, of fatty foods, or for those individuals who smoke. So the important thing, if we have excess of free radicals and we have the oxidative stress that causes damage to the body, if we have an excess of antioxidants, we have protection to cell structure, cell function, and to the macromolecules. So we always want to be on the positive side, much like in our bank accounts. We want to be replete of antioxidants. We know that the aging process is associated, as I'll show you, with a decrease in antioxidant defenses, and we need to start earlier by both topical and oral administration using buccal absorption route is one example of our antioxidants, and maintain this balance of power, positive on the antioxidant side. I think then, as prevention, we have accomplished the cosmeticos and the therapeuticos definitions of our discussion. The next slide, please. Here is the glutathione. Molecular weight 303, composed of glycine, glutamate, and cysteine. If you look at the bottom part of the slide there, the crucial part of the molecule is the sulfur and hydrogen group. It's the hydrogen that is given off to the free radicals that neutralize these and render them less toxic or even non-harmful. One additional comment about glutathione. We'll be spending the rest of our talk here, and please be sure to let me know about my time, because gastroenterologists tend to have verbal diarrhea, so I want to make sure that you stop me in time. But glutathione, besides its antioxidant capacity, has many other functions. It's the body's prime detoxificant, especially in the liver. It will detoxify the compounds generated from Tylenol. We all know that acetaminophen is toxic to the liver if there's not enough glutathione to neutralize it, to detoxify it. It's important that we recognize in our patients those groups of individuals who might have low levels of glutathione in their bodies, for we have to warn them about the ingestion of certain drugs as being deleterious to them, including Tylenol. Other very important function of glutathione, I like to call it the protectant function. And that is because data from the the literature and our own experiences would indicate that the higher the glutathione content of cells, the better it is to resist damage. Cells high in glutathione are more resistant to ultraviolet radiation. They're more resistant to damage by smoke. We also use this important information in our oncology, with our oncology colleagues. Cancer cells that are high in glutathione are far more resistant to radiation, to radiotherapy. They're far more resistant to chemotherapy. Conversely, if we can lower their glutathione levels, they're more sensitive to the chemotherapeutic and radiation therapy. So remember that keeping our cells high in glutathione will help protect them from sunlight. This is even before we talk about the sensitivity to ultraviolet radiation. Glutathione also has a very important role in certain enzyme systems. For instance, glutathione is a cofactor to the enzyme nitric oxide synthase. This, all of you will know, is important because the glutathione affecting this enzyme produces nitric oxide from arginine, and that's the most important vasodilator in maintaining erectile function. Glutathione inhibits tyrosinase activity, rendering the synthesis of melanin not toward the eumelanin, not toward the black melanins, but by decreasing tyrosinase activity and affecting the synthesis of melanins toward the pheomelanin, the clear melanins. So here are various functions of glutathione that are independent of its antioxidant quality. Two others that I'd like to mention, and that is that it may help prevent infection by certain viruses, particularly the influenza viruses in the oropharynx. We know also that it decreases the virulence, along with selenium, of other important viruses. And in many cases, like hepatitis C, it inhibits the replication of the virus. Same for human papillomavirus. So here's one way where our cosmetic antioxidant glutathione can participate as a therapeutic agent. And finally, for all of us who are interested in anti-aging, and the more years we spend alive, the more we want to emphasize longevity, it is the body's rejuvenator. Next slide, please. Well, a little biochemistry here. What happens? Over in your upper right hand, glutathione, the reduced molecule, is the antioxidant. In the lower portion on the right, you'll see that it neutralizes the free radical, rendering it less toxic or non-harmful. But in this process, giving up that H hydrogen atom that we talked about, it itself becomes oxidized. It's a disulfide, GSSG. And in this sense, accumulation of GSSG is an indicator of the redox state being in the oxidized, and therefore an example of oxidative stress. But the body fortunately has glutathione reductase, the enzyme that immediately recharges glutathione into its active form. And in this circle, this maintains the glutathione antioxidant cycle going. Next slide, please. And you can see in similar preparation here again to the right, it's synergistic partners in the cell. Selenomethionine, ascorbic acid as vitamin C antioxidant, tocopherol as the antioxidant vitamin E. Again, each one of these selects their own free radical to act on, and it neutralizes them. However, in that process, and repeat myself, there's oxidation of the vitamin C to an ascorbate. There's oxidation of the E to a tocopherol. And in this situation, accumulation of vitamin C, as we've seen in smokers and diabetics, may be toxic. In other words, the ascorbate free radical of vitamin C may act as any other free radical and cause the ravages to the skin, to the blood vessels that we know. So what's important is that it is glutathione and selenium that regenerate the vitamin C back to its ascorbic acid, and together they regenerate vitamin E. And this is the cycle that I'd like to emphasize, because this is the endogenous cycle that our system works, that our cells expand to fight the free radicals. Next slide, please. And here's another biochemical slide that take you back to medical school days. And you can see here on the upper right, hydrogen peroxide, one of the most damaging, called free radical, is a full molecule. And next to it is the glutathione, the reduced glutathione. Working, it can hydrolyze the hydrogen peroxide alone. However, if we have the enzyme glutathione peroxidase, probably the most important antioxidant enzyme in the body, we have glutathione peroxidase, which requires selenium to function. We have a rapid hydrolysis of hydrogen peroxide, and from the toxic molecule, we now have beautiful water. In that process, of course, the glutathione is oxidized to its GSSG and requires reduction again. But you can see very nicely how the process goes. The next slide is very similar, except now we have the ascorbate, the oxidized vitamin C at the top right, and you can see again that with an enzyme that requires selenium, this is thioreduxin reductase, the glutathione is able to neutralize the ascorbate back to ascorbic acid in the bottom right, and again, the system goes on. So this is the beauty, because these are the antioxidants that remain functioning in our body. This is compared to the exogenous antioxidants, the green tea and the grapeseed extract, which on their own are excellent antioxidants. They do their job, and they are then rapidly metabolized by the liver or the kidneys pharmacokinetically, because they're foreign proteins, foreign molecules. Not so for the group that we have in our cells. And that is the basic difference. We can maintain the system, and again, as I told you before, it's very important to maintain the system, including the glutathione, or especially the glutathione, because then the cells are much better protected against any type of injury. Next slide, please. All antioxidants are not created equal. What I'd like to emphasize here is one point. When you have somebody who has an infection and you say they're on antibiotics, that's a correct assumption. But do you know if it's penicillin for pneumonia or chloromycetin for typhoid fever, etc.? The same thing for the patient is on antioxidants. They fight free radicals. When you prescribe to your patients for topical and oral administration of products, you want to make sure that you're covering that area specifically where the patient is involved. And here again, we have those antioxidants that work in the aqueous phase of cells, the vitamin C and the glutathione predominantly, and those that work on lipids, the low-density lipoproteins in the cell membranes, our carotenoids, our vitamin E especially. So if we're dealing with problems of cardiovascular system and problems of oxidation of the LDLs, we certainly want to make sure that we're providing enough of the fat-soluble antioxidants. So just a thought, antioxidants are the same as antibiotics, got to be a bit more specific. And again, they don't work well together. Dr.